Okay, I think we are good to go. I think everyone is in the room. So welcome to the second session today of Recruitment Boot Camp, Mental Health Staff Edition. So today we're going to be talking about building a recruitment team and really understanding that value and the diversity of the mental health workforce. And we titled this being proactive and not reactive. So really preparing for what you need for your workforce and having everything in place. So as we get started today, I'm sorry, I see there's something in the chat. Oh, that was Mariah. Thank you, Mariah. So we are going to be going through very similar as we did last time through all the content, but I do want to allow for about the first 10 minutes of today's session to talk about what different people posted in the discussion board and just be able to answer some of your questions. So you would have already seen these slides last week. I just wanted to keep them in the PowerPoint. As you know, we are ACU and we're here through the STAR Center. Adija, Dr. Olunyemi, she is our lead faculty. And then just general housekeeping rules, please use the chat if you have any questions. Mariah is there to help you. We do have an evaluation at the end of the session, and it is being recorded, and we'll post that recording in the discussion board. We also know there were some technical issues with the discussion board, so hopefully that's all been fixed up and nobody is having any more problems. If you do, though, please feel free to contact either myself or Mariah, and we can help you troubleshoot that. And then really just be present. If you can be on camera, I see lots of you are already on camera, so that's wonderful. And just use this as an opportunity to share, be here for your health center, for yourself and your fellow cohort members. So as I mentioned, we are going to get started. Oh, I'm sorry, did somebody have a question? Nope, okay, sorry, I heard somebody. We are going to get started just hitting on some points on what we read in the discussion board. So what I'm going to do is I'm going to stop sharing the PowerPoint so we can all see each other. Great. Hi, everybody. Now I can see everybody. So we just wanted to go through a few topics, and then if you have any questions as well, sort of this is the space to bring them up. And one thing that we saw in the different, and thank you everybody who posted on the discussion board, we saw a theme, and we've seen this theme across the board of a lot of you talking about the difficulty of recruiting high quality candidates, those who are culturally competent, especially when it comes to language, and those who understand the health center model that you're working with, whatever that may be for your health center. And so we wanted to open it up to see if anybody had any specific questions or ideas that they wanted to share along with this. But what we wanted to let you know is these are all topics that we are going to hit on throughout this boot camp. So we specifically want to talk about how can you bring people in who are the right fit, but then also how do you get them to stay? Because a lot of times that retention component is key, because as you'll see, recruitment takes a lot of time, and that was also in one of the comments that we had. It's a big investment, it takes a lot of money, and once you bring someone in, you may train them, you may offer them those supervision hours, and then they leave. So now you're losing a lot from that. So, and I see the heads shaking when I say that. So these are all topics that we want to hit on and really build on it as we go through the learning collaborative. But I wanted to open it up to see if anybody had any questions, whether it be on the homework, anything that you posted, anything that you would like us to expand on, and then also to Dr. Olunyemi if she wanted to speak to any of this. Mm-hmm. Or rather than saying if you have any questions, what questions do you have? So I'll reframe it.
Well, I can start with the question about staff retention as it relates to limited license clinicians leaving after they gain the hours of supervision. I think in my experience, at least in Michigan, with the 3 CHCs that I've worked with, it's ideal to target hiring fully licensed clinicians. And I'll talk about this a little bit more in the presentation as well. I think that when you hire fully licensed clinicians, they more than likely kind of carved out a niche for themselves. They're more comfortable with the population that they want to work with. They know the job, as opposed to someone that's still trying to figure out where they fit, what kind of population they want to work with, or the setting that they would prefer. So the target should be fully licensed clinicians, just to answer that person's question. Yes, there are opportunities for you to have limited license, but I think that it's good to target fully licensed clinicians. Otherwise, you continue to run into the issue of people leaving after they've gained their supervision hours and things like that.
And one thing sort of on the flip that I wanted to add, because yes, you're going to be facing sort of that issue of, you know, people now have their license. Obviously, many times when you have your license, you could go somewhere else where you may be paid more. You know, somebody mentioned the documentation that it takes in health centers, especially around Medicaid, all of these different issues. So one of the other things that we've talked about in other trainings that we've done, when you're bringing in those people who are currently in training and you're working in the recruitment, you want to make that connection with your community. So work with those local schools that really are kind of the pipeline that are bringing in the different mental health providers, and really start establishing those relationships from the get-go. Because if you're going to bring someone in to train, you also want to make sure that they are the right fit for the health center. And when I say fit, that they are used to the health center model, the way that you do your primary care. And by the way, I just also want to apologize. I'm having a bit of brain fog today. I had my vaccine yesterday, so I realized I'm not feeling the best. So I'm sorry if I sound like I'm speaking in circles, but I am trying to make a point where it's basically when you bring someone in, you want to make sure that they're the right fit, that they're working within the health center model that you need. And sometimes bringing someone in to train around that is a great way to figure out that they're not going to be the right fit for you and that you're not making as much of an investment as hiring someone on. Or if you bring someone on that you are going to provide those supervision hours, having some type of agreement that, you know, because we are supervising you for X number of years or X number of hours, then you would stay for that long in the health center once you are licensed. Because there is a cost involved. If, for example, a social worker were to do this independently, there's a very high cost involved in getting those supervision licensing hours. So you can also utilize that as a tactic to recruit someone in, bring them in, and then be able to retain them.
Yes, and also to just to go back on that topic with Karen, I am curious to know how you're billing for services. Because in community health centers, a lot of insurance company and payer sources require that clinicians be fully licensed. So, for example, I've never worked in a CHC here in Michigan where there was a limited license clinician. So I'm just curious to see maybe the rules are different in the state or city where you're located, and that's the reason why you have more LL or let me use limited license clinicians that you're able to hire. If you don't mind answering that question. I think Karen Warner wrote that in the chat.
So I think Karen wrote into the chat.
Okay. Sorry, there's a couple of comments.
Right. So they're carefully juggling schedules with those patients are insured, etc.
Okay.
And I'm not sure if you're able to be on the phone, but I know, is it just simply, you said the scarcity is the reason that you need to bring in those people that are licensed. Yep, absolutely. And that makes complete sense. And that's why I say if you're bringing someone in with that limited license and that's sort of your only option in that moment, you know, you can make those, that option of, yes, we're going to offer you those supervision hours, but you also would have to stay here at a certain amount of time once you're licensed. Also, the expectation shouldn't be though that someone is going to stay there permanently forever, or even, you know, sometimes more than 3 to 5 years, unfortunately. So there needs to also be a preparation around that, because there is always turnover, and that is especially with a lot of younger clinicians who are coming in. It just sort of, you know, it's part of how things are going now. And I'm just trying to read through the chat. So I see that I am wondering how we could mitigate leaving after getting licensure, which is how we end up getting a lot of our clinicians who are limited license. Yeah. So, and that would be one of the ways that I would say that, and really strengthening your retention tactics in your health center. So making sure that your mental health workforce also knows that when they're there, they're valued. And I know that seems so simplistic, but people will stay in a place that they feel valued. May not necessarily have the same pay rate as somewhere else, but they have these benefits of feeling like, you know, maybe they have more freedom in how they practice, or just they're more respected in your health center, whatever it may be. Those can be very powerful tools to use. Right, and it is absolutely very time consuming. I completely agree. And I'm just trying to read through all of the chat. Adisha, do you see anything else in the chat that you would like to address?
Someone else said about Gloria said something about using a contract to keep them if it's appropriate. I think, again, this is all based on like the jurisdiction, the state or the city. I know some employers require clinicians to sign contracts that they're going to stay for this long. And, you know, they have the non-compete clause as well. So it's just all depends. And I think it might be beneficial, you know, if you're not an HR person, to work with an HR person of your company to see, can you do that? Yeah, I've seen jobs here in Michigan where they'll have sign-on bonuses with like 2 years contract, you know, added to it. So, you know, going in, this is how long you're going to be expected to stay. Also, I know that we're going to talk about that as well, is for the fully licensed clinicians, utilizing the NHSC loan repayment program, which actually is open right now. The applications are open right now, utilizing that as a way for staff retention. I would say that's one of the reasons I stayed as long as I have too with my current employer, in addition to me liking what I do, of course, because I was done with that 3 years ago and I'm still in the CAC world. So utilizing that to your advantage. A lot of CACs I've noticed don't say that. They just post the job and then hoping to find somebody. You should put that in your job postings. What makes your CHC unique to work for? What kind of population you work with? What you're looking for in a future candidate, as well as what you're bringing to the table. So that way, it just makes it, the healthcare world is competitive, like we already know that. So what makes your CHC stand out to a potential candidate, and what will make them want to stay after they're done with that, you know, loan repayment program period?
Yep, absolutely. And like Adisha said, you know, be upfront right from those postings. You know, this is what we offer. This is what we have. You know, really bring people in that are drawn to that, because then they'll also want to stay. So use every tool in your toolbox to get someone. And I agree that when you're an at-will employer, then that's very different. So I was thinking, yes, in regards to, you know, you come in, you kind of know we have X number of years that we're going to be here. So, you know, when you're not able to do that, also just making it an environment that people want to stay. Like I said, that sounds really simple, but it can be very effective. And that's difficult because obviously that also takes leadership buy-in. There's a lot of components that go into that, but it's looking at putting in that investment so that that turnover and the cost associated with that you can decrease, and really making that case to leadership as to why, you know, lowering that is so important and putting in the investment up front. So I believe we may have responded to all the questions. So if there's anything that we missed, you can please let us know. When I see a lot of people, yep, a lot of people have really great.
That's a great point. Yeah.
Yep, with the loans, and absolutely, that is a great way to really bring people in and have them stay. So I'm gonna, just for the sake of time, I'm gonna go back to the presentation, and then at the end we'll have more Q&A. But I really just wanted to hit on those points that that were brought up in the discussion board, and any questions that you may have. And like I said, if I missed anything in the chat, you know, please feel free at the end of the session, ask your question again, or reach out to us in the discussion board or through email, and we'll be able to answer that. Okay, so today, as I mentioned, we're going to be talking about the recruitment team. So in the first session, I talked about how recruitment is all about incremental steps. You really need to have everything in place before you could go to the next one. Now, simply because we only have 6 sessions, we're going to be really honing in on certain parts of this recruitment process. And then Adija is going to come in and explain what are all the differences with all these mental health providers, because there are many different types of behavioral health specialists, mental health providers, psychiatrists, psychologists, social workers. You know, it can be very complex. So when you're recruiting, you also need to know what your needs are and who you're bringing in. So what I highlighted here in red is we're going to talk about the recruitment team. And even though I'm not going to go in as much detail into community priorities, budget, and recruiting firms, these are also important concepts to think about. So when I talk about building a recruitment team, it means literally putting together the people in your health center who you need to bring in the right people. So a lot of times when it comes to recruitment, we only sort of think about HR, or maybe if you have a workforce specialist in your health center, or the person who is in charge of that specific, you know, like the chief medical officer maybe, or the behavioral health director, whatever it may be. But there's so many individuals that can be involved in the recruiting process. It's just knowing what tasks they need to do, and then where are those gaps in your recruiting process that they need to really fill in. And one thing that is really important as we talk about this in regards to mental health is you need to have individuals who also work in that field in your health center as part of the recruitment team, because they're the ones who are going to really know, are we bringing in the right individual for this position? So not only from the, you know, things such as licensure and training, but also just in the way that they speak about their, the way that they practice, you know, understanding some nuances that maybe may not be there if this is not something in your background. And I did see, and I'm trying to remember the name, and I apologize, in the discussion board, somebody who posted how they're training their HR team on mental health and what that means and how much that has helped in recruitment. And that is excellent, because not only do you want to bring in people who are working in that area, who are already in your health center, but you also want to train the staff to prepare to understand this specific field. So building out a recruitment team is essential. Now, before I continue, I talked about, if you saw on that little sort of step ladder, community was one of the first ones. And that really just means making those connections into community. And it's very similar to what I talked about, where I said, you know, talk to your local schools, other hospitals, private practitioners, you know, whoever may be, to really see what is out there with the healthcare industry. As Dr. Olunyemi said, it's very competitive. So the more that you can get and find out what is going on in your community, the better you'll be set as you start putting together this recruitment team and really filling in all the people that need to be in place to get the best qualified candidates that you can. Now, of course, you have to address the scarcity of, you know, who is applying. So it's much more complex than simply just saying we have the recruitment team in place, we're going to get the best people in. So, you know, having all of those steps, building the connections with your community, having your right recruitment team in place, and then understanding what you're really putting out there to get back into your health center is very important. So you want to have the team together in advance. You want to allow for input. This is especially true from those individuals who are behavioral health providers right now in your health center. And where it says here, remember that your team must act quickly, that means that if you have someone that you want to bring on to your health center, you need to work quickly with this, because you don't want someone who is a great fit, you know, is going to be an amazing addition to your health center, and because the turnaround time was not quick enough, or the reaching back out to them was not quick enough, or you didn't have enough people to sort of do the recruitment process, so you weren't able to do it in a timely manner, whatever it may be, you don't want to lose people for that. So that's why you want to make sure that as many people as you can to have on the recruitment team. But of course, just like anything else, you need to make sure that everybody knows what their roles are, everybody knows what their responsibilities are, and their availability and their skills. And it's complicated because most people who you are going to be putting on the team, outside of those individuals who are in HR or solely in workforce, have other roles that they play in the health center. So you need to really manage that time. And I think all of us, working in health centers are probably masters at time management, and you definitely don't want to add something else to someone who is not on board with doing this. So that's also really important. If you really feel it's important to bring on a certain mental health provider, and for some reason that person is just like, I don't have time for this, this is not what I want to do, then you really need to look at, could we find another provider? Could we find someone else to really fit that role and have it be appropriate for our recruitment team? And again, of course, also speaking to leadership about this, because if you have the right people in the recruitment team, it really is going to help you bring in the right people to your health center. Even also with just what their networks are, who they may know. You may be surprised at how much, information people really have once they're brought in into the recruitment team. And just whatever their role is, again, always define their position. Again, going back to working with community partners. It may be the competition, but it's also a great resource. So the more that you can see what other health entities are doing, the better it's going to be. Because you also may just get ideas, tips, tricks, whatever it may be, but you may have an insight into great candidates that you may not have had otherwise, solely from just posting sort of within the health center community. The recruitment team is going to help you with sourcing those candidates. You could probably get great referrals through the people who are on your team. They're going to help with the screening and the interviewing process. These are all things that take a lot of time. And I know that that was one of the comments that we've seen, is that recruiting is very time consuming. So the more that you already have in place, the more that this is almost becomes kind of like a second nature to you, the less time consuming it's going to be. It's like everybody knows where they need to be, what they need to be doing, and they're able to just go. And this is why a comprehensive workforce plan is so important, because all of that is written down and you can see what works, see what doesn't, and every time just keep refining it more and more. Have all your data, have all your pieces written down, and then hopefully that time component will not be as big of a barrier as it is for many of you. And then as I begin to wrap up this section so I can pass it over to Dr. Owunyemi, I wanted to have this chart on here because this is actually going to be what your homework is going to be based on. So this is one of the tables in our retention and recruitment plan. And we basically just want you to identify who should be part of your recruitment team. Write that position and write what their responsibilities are. Now, of course, sometimes we get back, this is not something that leadership is going to let me do. This is, we have certain other barriers. But I would suggest to write down who you really think should be part of that recruitment team. And then we can talk more about how to really make that case as to why they need to be there. But having that in writing, really showing that, this individual's time is not going to be wasted by doing this. These are the responsibilities that they're going to take on. And at the end of the day, it's going to allow us to bring someone in who will hopefully stay, not have the turnover that we may be facing, which is going to end up costing a lot more money anyways. These are great data points to bring and make the case for yourself. So the homework is going to be based on this, and you'll be filling that out, and just really try to think as creatively as possible also about who should be on the team, who you already have on the team, who you may want on the team, and make sure the importance of including people who are already in behavioral and mental health. So that was a general overview of the recruitment team, what you need, and in a moment, I'm going to pass it over to Dr. Owunyemi, and she's going to talk about the different mental health providers, what they mean, the type of licenses they have, the roles that they play. And I'm going to keep reiterating this in every session we do, regardless of what you do with recruitment and retention, you also need to be very intentional about DEI and representation. So this is both from the perspective of having providers that reflect the community you serve, but also having diversity within your health center. And I also speak about just diversity in practice, diversity in training, diversity in their academic backgrounds. All of these different types of things really are going to strengthen your behavioral and mental health part of your health center. But of course, it is essential that you have providers who reflect your community. And this was something also that we brought up. You know, people have a very hard time, especially for those who are bilingual. And one of the things that I really recommend with that, it goes back, make those connections with the people in your community. See who is the pipeline really that's coming to you with these providers. You know, where can you reach out to more, you know, Spanish speaking? A lot of the comments were around Spanish speaking providers. You know, what are the schools that really are putting out students who have these bilingual skills, who are focused on DEI? So, you know, it takes a little bit more a few more steps. It goes into that time commitment, but it's really more of an initial time commitment that then allows you to sort of free up, because you have those connections, hopefully, that you need to start kind of chipping away a little bit at that scarcity that we talk about. And I always put this slide in here, and it's basically just, this is more for everybody of just sort of understanding the definitions around these three components. And it's just to show that you can be diverse, but not necessarily equitable and not necessarily have inclusion. So when you're thinking about the job postings you're putting out there, and we talked about one of the things that can help entice people is the National Health Service Corps loan repayment, but also some people are really looking to work in a place that really embraces and honors DEI. So are you just putting in your job placement, you know, like an equal employment or equal opportunity employer, or are you really marketing to people saying, you know, this is our values, this is who we are? So all of these things that, you know, may in some ways not seem as something that needs to as obviously be put out there, can be really enticing to someone who wants to work at a mission-driven organization, because they want to know that the mission not only reflects those that are being served, but that those values are also reflecting how they work within the health center and what they bring and the addition that they provide. So as I said, this slide really is more just for information, for the definitions, but please keep this in mind as we really go through and talk about the importance of all of these components. And now I can pass it over to Dr. Olunyemi.
All right, thank you so much, Michelle. I wanted to just kind of reiterate a couple of things that Michelle stated in regards to the recruitment team. I was thinking, as you were speaking, I was thinking about, we had 4 great hires in 2019 to our department for the CAC where I work. And I think that what was really good with those hires was that the CMO, the Chief Medical Officer, turned over the hiring process to us. So she said, behavioral health department, you do your hires, do everything that you need to do before they even go to HR. That's what she did. And we're able to get 4, they're still with the company. When I say great additions, I mean great additions from physicians to peer support to behavioral health clinicians, therapists. So I think that it's really important. I'm not saying that you need to do that with your specific CACs. You might not even have the power to do that, but just advocating for the importance of having at least a member of the job that you're trying to interview for be a part of that team, because they know the ins and outs of the job. They know what a day in the life of a mental health therapist or provider is. So they'll be able to give a different insight or different input to that interviewing process. So I just wanted to reiterate that, because that was something that we were successful with at my current CAC. So now moving into diversity. Diversity is incredibly important when we talk about community healthcare, because the lives of people, you know, literally depends on it, right? Community health centers, they serve a countless numbers of individuals, families, and communities. And according to the National Association of Community Health Centers, nationally, 63% of health center patients are members of a racial or ethnic minority group, compared to 40% of the general United States population. So that is a lot of people that are utilizing the services of community health centers. 1 in 12 people receive healthcare services from health centers, and that includes children, racial ethnic minorities, Medicaid beneficiaries, uninsured persons, and people, living in poverty. So diversity is important because it would allow us to best communicate, understand, and treat patients with the best care possible. It is vital that they see themselves in a healthcare workforce that is serving them. I remember one of the clinics that I work in, that particular clinic, it's a predominantly white neighborhood. It's a Caucasian population. But one day I had a Nigerian couple. I'm Nigerian. One day I had a Nigerian couple come into the clinic, and they were just so like, oh my God, just one of us is here. And that just speaks to diversity, right? That speaks to the importance of making sure that you have people on your team that could relate to people in one way or the other. And when we embrace diversity in healthcare, it can really lead to that cultural competency that we're trying to achieve in how we serve our clients. Next slide, please. So now we'll move on into discussing the different types of mental health care professionals in primary care. And there are quite a few, like Michelle said. I want us to please note that, the job titles and specialties may vary by state, just like with the licensed clinicians, fully licensed, limited license, associate, it will vary by state. But, I'll just give like a general overview of it so that you can know what to look for when you're trying to find the right professional that'll be a great addition to your individual teams. So we'll go over some of the main mental health professionals in the community mental health setting. And I'll also discuss with you an overview of what to look for, the credentials and what have you. So within the mental health department, I think that it was important to kind of divide it up into three based on the services provided. So we have a group of mental health providers to provide psychotherapy and assessment. You have a group of mental health providers that provide mental medication management, and then you have the enabling services. So moving into we'll first go over the psychotherapy and assessment. Next slide, please. And with that, we have the psychologists, we have clinical social workers, counselors, therapists, and what have you. So with the psychologists, sorry, Michelle, next slide. So with the psychologists, they hold a doctoral degree in clinical psychology or another psychology specialty, such as counseling or education. Why is this important? Typically, people confuse psychology with psychiatry. And you will find that some other providers don't even know the difference either. So it's important to know the difference between being a psychologist and a psychiatrist, or being a psychologist and a social worker. So psychologists are individuals who have a doctoral degree in psychology, whether it's in psychology or other type of specialty, or you also have the psychology holders that are PsyD. So a PhD in psychology is a doctorate degree in psychology. Then you have the psychologists that have the PsyD, meaning that they have a practice degree, not a research degree. So one is a PhD, one is a PsyD. The PhD is a research degree. The PsyD is a practice degree. They can do the same thing. Just to put that out there, they do the same thing. And they're trained, to evaluate and treat illnesses, such as do clinical interviews. They treat illnesses from anxiety disorders to schizophrenia. And it's important to also note that their licensure may vary by state. In Michigan, I think they're LPC. I don't know what they are in other states, but make sure that they're fully licensed. That is so important, fully licensed. Now we'll move on to the other type of mental health provider under the psychotherapy and assessment, and that's the licensed clinical social worker, which I'm a proud member of that group of clinicians. Social workers usually have a master's degree in social work. There's some that have doctoral degrees as well, and they're trained to evaluate a person's mental health and use different therapeutic approaches to treat common mental illnesses. Social workers, unlike other mental health professionals, are trained to provide treatment using that biopsychosocial framework. You come to a social worker for treatment, they're looking at, okay, you've been sad for months. Do you have food? Do you have shelter? We're looking at things from that perspective. And licensure, again, will vary by, state, but one general one that I know a lot of states use is the LCSW, meaning licensed clinical social worker, which indicates that that person is fully licensed. Here in my state, we have the limited license. I think some states use associate social worker, what have you. but your target should be a fully licensed social work clinician when you're looking for someone for the CHC setting. And why is it important for us to have a fully licensed clinician? Having a fully licensed clinician allows us to be able to bill independently. As a fully licensed clinician in the state of Michigan, I'm able to have my own practice, bill independently. There are no insurance issues when it comes to that. Also, having a fully licensed clinician it avoids delays. When you have limited licensed clinicians on your staff, more than likely somebody else has to sign up on their notes before they can submit the billing, and before the billing department can process that whole the whole billing procedure before they can complete their task. So that's why it's important to target fully licensed clinicians. Moving on to counselors, which are other types of therapists, clinicians, mental health providers that provide therapy. Counselors are master level healthcare professionals that are also trained to evaluate a person's mental health, as well as use therapeutic techniques, for specific mental health issues. They can hold a master's degree in science or a master's degree of master of arts degree, and they would have a degree in a mental health related field, such as psychology, counseling, marriage or family therapy, among others. Some of their licensure include the LPC, which is the licensed professional counselor, or the LMFT, which is popular as well. I see that a lot where people have that degree. So that might be something that you're familiar with. Having a LMFT on your team, I think, is so beneficial, because a lot of times you would have clinicians that don't have that specialty training or experience. However, you have families that are coming to your clinic possibly seeking marriage counseling or family therapy. So I think having an LMFT on your team will be beneficial if you can find one. Now we'll move on to the other umbrella of behavioral health, mental health treatment, and that's the medication management. Primary healthcare physicians can provide the services, psychiatrists or psychiatric nurse practitioner. We'll go into primary care physician. While a lot of primary care physicians are moving away from providing mental health services, as far as prescribing medication, they still can, right? It's ideal for them to move to a psychiatrist or move to a nurse practitioner, but they still can do it if they want to. Anyways, that's what I'm finding with my primary care providers over here. If they want to, they still can do it. They can prescribe medications for mental health disorders. I think a lot of times why PCPs don't want to do it is because of the continuity of care as it relates to that specific illness. They would rather it go to a specialist. And primary healthcare physicians, they have an MD or a DO, as we all probably familiar with. Next are the psychiatrists. They are so hard to find. There's a shortage of psychiatrists as well, because a lot of them are in retirement age. So I know there's been a lot of push to get, the younger people that are going into medicine to pursue psychiatry. And I know quite a couple now that are going to it, which is quite exciting. So yes, psychiatrists are, the primary providers of medication management in the behavioral health, mental health field. They're usually MDs or they have DOs. Also, I've met once MD that was also a psychiatrist. So it does primary care and psychiatry as well. And it was pretty cool when we had him on our team before he left. They have to be fully licensed by their state and board certified and all of that, good stuff. The next are psychiatric nurse practitioners, which is a growing field now. I do a lot of research because I'm just nosy about mental health and what the future holds for mental health. It's a growing field. I'm seeing a lot of nurse practitioners going into this field to get their certificate, because a lot of people, and this might be beneficial to you, if you have people on your team that are nurse practitioners that may be interested in being a psychiatric provider, maybe the company can sponsor them to get that certificate and then have some kind of contract with them so they will stay on board for 2 to 3 years after they're done, because it's literally a certificate that they have to go to and take the exam, and then they become a psychiatric nurse practitioner. So if you have some clinicians on your staff that are interested in that, a good way is by possibly sponsoring them or using the NHSC there also to your advantage, because they do have some programs for education as well, mental health education. All right. So in some states, nurse practitioners can practice independently. Michigan is not one of them. Very few states they can practice independently, but in Michigan, they require a supervision or they need to work under a doctor, an MD or a psychiatrist. And again, they have to be fully licensed in their state as well. Their exam is called the NCLEX exam and also board certified through the American Academy of Nurse Credentialing Center. Now we'll move on under the other umbrella of mental health services, and that's the enabling services. While they're not a service that a type of service that they don't bill for their services. That's what I'm trying to say. They don't bill for their services. They're absolutely very important because they address a lot of social determinant of health barriers to access primary care, or those things that hinder people from accessing primary care. Next slide, please. I would say that, on my team right now, we have a peer support specialist, and she's very instrumental, very knowledgeable in community resources. So a lot of times when you have patients that are coming to therapy, but they have transportation issues, or they have food, lack of food issues, our peer support she'll just call them up like, okay, you can go here and get this and get that. So they're very instrumental on the team to have enabling services if you're able to, have that. They are typically, again, non-reimbursable. Their services, they can be social workers, but in this instance, they're usually bachelor level social workers that provide case management services. I've worked with bachelor level social workers. Maybe patients need to apply for medical insurance. They do that, food stamps, what have you. They can help patients get those entitlements that a lot of people are not aware that it's available to them. You also have community health workers, and they provide health education and promotion within the community that they serve and beyond. Our community health workers with my current employer, they do a lot of, prior to the pandemic, they do a lot of community events where they invite community individuals that live in the community and families to promote mental health. They might have like a family week and at each of our centers where they have free food so people can come and do their health checkup, diabetes checkup, blood pressure checkup. And that way, that's a good way to get patients utilizing services at the health center or becoming aware that the health center is there in the first place. And then again, you have the certified peer support specialist. This is a role that is gaining more and more attention as the issue of the substance abuse issues arising at the opioid epidemic continues to happen in our country, especially in Michigan. We've experienced that increase in opioid overdose. So peer support specialists are becoming a part of the mental health field, and there are people that have lived experiences with a mental health condition or substance abuse or both, and they're often trained and certified by the state. So the state of Michigan has a peer support specialist program that people go through, and then they become certified in providing those services. Okay, so that is that for, you can move on to the next slide. That's that for the different types of mental health providers that are available. Now we'll discuss, why does clinical staff or non-clinical staff, why do they need to understand the difference? They need to because they can be educated on the type of mental health services available at the health center. When staff is aware of the services that we provide, they can be a part of getting us more patients. Because especially with the front desk staff, when patients call and say, oh, I'm looking for a marriage therapist. You're like, oh no, we don't have that here. Whereas you have an LMFT on staff. So understanding the differences in the mental health with the mental health providers, as well as the services that they provide, could really help in gaining more patients for your health centers. Also, it allows for appropriate referrals to be made or consultation. I can't tell you how many times that I get referrals for, oh, this person is homeless with my current employer now. And I'm like, well, I am a social worker. I do know how to do it, but that is not really within my scope of practice right now, because we have a department that does that. So it just allows for a smooth process, and you're not wasting time throughout your day addressing things that's not necessarily what you do. It just allows you to be able to focus on what exactly it is that you're hired for. Moving on into how health centers should know, or recruiters should know, or assess rather who they need to recruit. Finding and retaining mental health providers, they've been a long challenge in community health centers. I know that from being somebody that's been on the recruiting end as well, that you have to move quickly, like Michelle was stating earlier. And because when you don't have a clinician, it's a loss to the company and it's a loss to the community that you're serving, because people don't have the right support that they need. And ineffective recruitment and retention can limit access to basic healthcare services for thousands of patients. And it can spread out over hundreds of miles because a lot of people cannot travel outside of their community of care or care. Next slide, please. So before we discuss how health centers can know or assess who they need to recruit, we must first discuss some factors that affect recruitment and retention. And as we already discussed in our Q&A earlier, is the competitive market. And that's the inability for many underfunded centers to provide the same salary ranges for people, because if I'm getting a higher salary at another job, I'll more than likely kind of entertain that job before I entertain a lower paying job. And higher salaries and employer established reimbursement, they help to improve provider retention. Another thing is too much focus on recruitment. And what do I mean by that? Because of the competitive market, many community health center organizations who are desperate to provide care, they only focus on recruitment and they just jump to hiring people without giving much thought to how they plan to retain those candidates, without giving much thought to how those potential candidates are a great addition to the organization. Because if you hire somebody that their mission and value doesn't mesh well with the mission and value of the community health center, that is a waste of recruitment because they're going to end up leaving, right? So recruiting is a short-term solution that involves identifying a workforce need and finding candidates that meet the need, while retention requires a long-term view focusing. So another way to maybe improve our retention method is, again, going back to utilizing the mental health provider. Sorry, there's a chat, but we'll talk about that later. Going back to utilizing the mental health providers on your team. They can help you identify who would be, again, the great addition to the team. Because sometimes you can have people, they can have all the credentials, but it's just not the right setting for them. So utilizing those mental health providers. Another factor that affects recruitment and retention is the shortage of mental health providers. But the good news is that this is a particular field of social work that it's expected to grow 25% between 2019 to 2029. There's a lot of people that are looking to get into this field. So the social work field is growing, but the fastest growing is the mental health field of social work. I can tell you, I have more mentees now than I ever have because more and more people are looking to get into this field. So that's the good news there. So those are some of the factors that affect recruitment and retention. We can talk about some more during our Q&A. Now, how do health centers know, or how do health centers know or assess who they need to recruit? Education and training is important, and licensing, like we talked about. That's how you can kind of I don't want to use the word weed out, but that's the best word I can find right now. That's how you can kind of weed out who would be the great addition to your team. Experience and years of practice is important. You want to look for candidates that have years of experience in the field. And I'm also speaking from a social work perspective. A social worker that is like 2 to 3 years in, more than likely hasn't quite figured out yet the population that they want to work with. You want to look for somebody that's like 3 to 5 years and above, because they've more than likely figured out through past employments, unfortunately, they figured out where they would like to serve, because social work is a service. And you have to like what you do. You have to like the population you're working with. You have to like the organization or the setting that you want to work with, so that when the difficulties of the job comes, you still have that focus in mind, like, this is where I want to be. I can tell you without a shadow of a doubt, there's a lot of issues that comes up in community health centers. There's a lot of challenges that we encounter. But for me, the reason why I've stayed even 3 years after my NHSC loan repayment is over is because this is a population I want to work with. This is where I want to be, and this is where I feel like I'm making a difference. areas of specialty is also important when you're looking at how to assess who to hire, who to recruit, and also encouraging diverse applicants. A lot of people, I can't tell you, I mentioned my mentees earlier, a lot of them are young African Americans that had no idea they could do this kind of social work. They had no idea this is the kind of job that they could do. So making sure that you promote diversity and encourage diversity, because in that way, it opens up the pool of applicants for you as well. I know we're running out of time, so I'm going to go through this. Why is it so important for us for providers to reflect the patient population that they serve? Number one is that it promotes improved care for diverse population. I gave my example earlier about how I had a Nigerian couple come into the clinic just kind of scared, and then they saw me and it's like, oh my God, one of us. Anyways, a healthcare staff should be as diverse as possible, if not more diverse than the patient base they're treating, because it just helps to ensure that no matter who walks through the door, there's someone on staff who they can identify with and who they can communicate with or better serve their individual needs. Also, better recruitment. A commitment to diversity helps when recruiting new healthcare centers and administrative staff as well, because it allows you to cast a wider net. Like I said earlier, it just opens up that pool of applicants for you. And also better problem solving. A wide range of perspective can lead to more creative solutions when solving problems during an emergency or even during routine patient care. I remember last year I watched a video of an African-American lady that was going through surgery. Now, this is not a CAC setting, but I think it was important. She had a surgeon that was also African-American, and he understood the importance of Black women and their hair and all of that. And he was able to like braid her hair in such a way that he didn't have to cut it during her surgery. And again, that just goes to that cultural competency and that inclusive services that we provide. So that is about it for this week. Again, we've covered, the mental health department and the different services that are within the mental health department. We've talked about why it is important for clinicians, clinical and non-clinical, to understand those differences. And we'll also talk about some of the things to look for when we're looking for a potential candidate. Yes, the market is competitive. Yes, there's a shortage, but there's still good people out there because we were able to find quite a few. So leaving it to Michelle.
And I do want to also add, Dr. Hunyami brought such a good point about talking about the people who do enabling services. So the talent that you already have in your health center with these people who are either early on in their careers or are doing, they may not be thinking even at that point, like, oh, one day I'm going to be a licensed clinician. But you can really start honing that in your health center with individuals who are working in these positions and, really getting that passion for them to want to move up, to go into these type of professions. They're already there. They already know, is this the population I want to work with? Or is this definitely not what I want to do? Or do I love what I'm doing right now? I just want to say, these assessments are great because you have a lot of talent who is already working in your health center who may not necessarily have all the credentials that you need to get to that point, but we can really develop that. And that's a big part of also understanding what mental health providers do. Because it's very easy. As a social worker, if, I'm working somewhere and someone's like, oh, you're just a counselor, or I don't understand what's the difference between a psychologist or psychiatrist. That's a very easy way for me to assess, like, this place does not get what I do, and it's like those simple things of you've put so much work and effort to get to a certain point, but you have people there that you can hone those skills and, offer them the opportunities of maybe the health center can help with some of the school funding, some of the preparation to get them to those points, because they've already achieved a certain level of comfortability and understanding of the services that you provide. So don't overlook who you have in your health center at all levels, because you never know, they could in the future be some of your best mental health providers, especially now with COVID, where mental health, we're talking about this openly, and I have never seen this much conversation around mental health. So it's it's just really utilize that. And all of you as recruiters and working in workforce, you're also advocates, whether you realize it or not. You're advocates for the people in your health center. You're advocates for the strengthening of these departments. So, you know, use your power in that. But I just wanted to mention that, but I do also, I know we have about 5 minutes, and I want to open it up for questions, but I also do want to, I saw Jamie's comment, and yes, recruitment is definitely not the only solution. As a matter of fact, really start first with seeing what are the retention issues that you may have, to then figure out what is the best way to recruit. Because if you bring someone into a place that just, you know, people are not staying, it's hard. You could have the best recruitment in the world to get them to stay. So does anybody have any other, oh, I see. Yep.
Oh, that's great, Bonnie.
Absolutely. Yep, and retention starts in the recruiting stage. I completely agree with that. And just so everybody knows too, and I'm sorry I didn't mention it at the beginning, you can also unmute yourself if you would like to speak. Please feel free to do that. Thank you for understanding about my brain fog today. My sincerest apologies on that.
You did well,
and
Michelle.
And Christina said, you know, if somebody would be willing to share the statement, please also do that. You know, if you have something that's working really well, share it with each other. So you could do it in the discussion board, you could do it here, you could send it to one of us and we could share it. Oh, thank you, Bonnie. Yes, I'm so glad I got my vaccine. You know, this is all about that peer sharing component as well. In the final session, we're actually going to have everybody in breakout groups. All of you are going to be talking to each other. So please share all of the resources that you have. And those job postings should really be specific. You know, talk about how your health center values mental health, how your health center values behavioral health. What you're looking for. And I'm not just talking about licensure and the academic background or whatever it is, but, you know, somebody who has these values that we share, somebody who wants, this is the population we serve, and this is specifically, you know, we're looking for people interested in working in this population. All of those different things really make it specific to the ideal candidate that you are looking for. Oh yeah, and I see Bonnie shared.
Yes, thank you, Bonnie.
Yep. And what I will do, so we are saving the chat. I'm going to take what Bonnie posted and I'll also post it on the discussion board. So if anybody doesn't have it here now, yep. So yep, Christina, no problem. We'll make sure to post that. And like I said, if anybody has anything else to share, send it our way and either I can post it or please go to the discussion board to do that.
So she said a challenge too.
Oh, I see this.
Yes, we'll work on doing that. I think that's important to talk about. So that way it can help people manage their expectations when they're coming into the FQAC world. Because that was an adjustment for me as well.
And one thing that I want to say that with the few minutes that we have left, this is also one of the things that is really great to sort of honing in already who you have in your health center, who may have an interest in going into these type of fields, you know, speaking with schools of different types of mental health providers, because you can start putting in those seeds of what is the health center model really, and like this primary care integrated model of care that we provide, because that's not going to work for everyone. And you may have a perfect candidate, but if that does not work for them, it's not going to work, you know, for everyone. And you don't want people to be miserable, because at the end of the day, all that it's going to do is reflect on the patients that you are serving. So, you know, we're definitely going to talk about this. We're going to bring this up in a few other sessions, but that's something to keep in mind, that right fit means, or an addition to your health center means many, many different things. And that's why you really serve as those advocates for having, you know, the right people in the recruitment team. That's why you want to have the behavioral health providers in the recruitment team who already know that model of care. You want to have the mentors, whatever it may be.
Yes.
And if nobody has any other questions, Dr. Lunyemi, was there anything else you wanted to add? I didn't want to monopolize the last final few minutes.
No. I was just looking at that last question that we'll work on addressing that in the future so that you can have your questions answered.
Absolutely. Well, thank you so much, everyone, for being here today. I'm looking forward to our next session, which I had on the slide. I don't know if I have time to show, but it is on April 14th. Let me see if I can. There we go. So the assignment is on the discussion board. And it's, like I said, that recruitment team and budget tables, it's just really helpful to kind of know where you are. Next session is on the 14th. And then the other 3 bullet points are the same from session 1. So, if you haven't had the chance, please go ahead and do that. And anything that you need, we are here to help you. And thank you so much, everyone.
Yes, thank you all. See you in 2 weeks.